Guys, what's up? Okay, today's video is about surgical site infection. Surgical site infection technically occurs in hospital. It's one of the hospital-acquired infection spectrum because surgeries occur in hospital. So you give the infection from the surgery, the infection. Okay, let's get started. We'll learn a lot of things about surgical site infection, something about interesting history and the sources of infection, the various presentations and how to treat it, how to prevent it, etc. Okay, so do you guys have you guys ever wondered that wine and vinegar are not more than drinking? They were used as an antiseptic agent by a great person called Hippocrates. Also, Romans told that pus needs to be removed, which means they were intelligent too. But what did Galen say? Galen said pus removal is bad. After which, a lot of people tried and applied their own feces in order to accumulate a lot of pus, but however, they all died of suppuration. That was said by Galen, okay? And there was, Hippocrates was used vinegar and wine, and the Romans said that pus needs to be drained. Galen said pus was good. And after that, the person called Ignaz Semmelweis said that puerperal sepsis can be prevented by a simple method of hand washing between by the doctor, obviously, between handling of two patients. So that's what Semmelweis said. Of course, guys, these guys, Koch, Louis Pasteur, Joseph Lister, they're the kings of antibiotics or antimicrobiology, right? So Koch has his four postulates. Louis Pasteur is known for his Pasteur Institute Paris. Lister is the father of antisepsis. So about this guy, this is Alexander the Great. But did you ever know about this police constable called Alexander? So Alexander the Great is very known for his discovery of penicillin, but however his penicillin discovery was not immediately utilized by everybody, after which a second group of people, that is Fleury and Chain, they were the ones who first used penicillin to treat a police constable who had sepsis due to some chance. Well, that's an interesting story. He was pricked by a thorn in a rose, so from that he got an infection. After which he was treated with penicillin. But however, in future days, as days passed by, the penicillin, the Florian chain ran short of penicillin, and after which this Alexander, the great constable, he died. So that's about the story of Fleming and Florian Chain and Alexander the police constable. And so now from we'll go to the present from the history. So in modern day, antibiotics are used on and off, like right and left everywhere. And delayed primary closure or secondary closure is advocated whenever the wound is infected. So there are these a lot of organisms which are responsible for the infection, especially in hospital-acquired infection spectrum. So Streptococcus, Pyogenes faecalis, Staphylococcus aureus, epidermidis, MRSA, of course. MRSA stands for methicillin-resistant Staphylococcus aureus. Europeans were able to keep MRSA infection in check in their hospitals by searching and destroying. So whenever a person comes in for a surgery, an elective surgery, they search for them. I mean, they screen for the Staphylococcus infection and they destroy the infection by giving antibiotics to them, and that's it. That's how Europeans control MRSA. Clostridium perfringens cause gas gangrene. Clostridium tetani causes tetanus. Difficile causes pseudomembranous colitis. Aerobic bacteria such as bacteroides, which screw up the pancreas and also the abdomen, cause soft tissue infections. Escherichia, Klebsiella, Pseudomonas are also others. Sources are, however, divided simply into endo and exogenous. Endogenous is mainly from a ruptured appendicitis, whereas exogenous is due to us, mainly the surgeon. Poor surgical technique and from the hand, so when the surface of the skin that has a lot of normal microbial flora, so when we don't sterilize the skin and we directly put an incision, that is going to enter, and it's due to poor hospital techniques, so it's a hospital acquired infection. And then about the factors, we have three factors: host, agent, and tissue factor, based on which whether a surgical site infection will occur to the patient or not will be decided. So the host response in the host immunity is good. Factors which decided: agent, the virulence and the disease spread, we'll know more about that. and based on whether the tissue has vascularity or it's a dead tissue as well. So what's a decisive period? I would consider decisive period as a window period, the period between the injury, that is injury which is gonna get infected, and the maximum time limit of prevention. So this is a 4-hour interval between which the bacteria is growing. So during which, if we initiate good prophylaxis, we are going to prevent the infection. So I would consider it as a window period. About the risk factors: malnutrition, so you don't eat properly; immunosuppression; metabolic diseases like what, diabetes, chronic renal disease, and gastric upset and reduced vascularity, foreign bodies, and poor systemic circulation, because of a lot of systemic diseases are risk factors. And about the presentation, a surgical site infection could present in the form of major or minor disease. Major is obviously major, so it has a higher heart rate, higher blood pressure, higher temperature, higher WBCs, means leukocytosis. Pus will be there. Delayed home return, and systemically the person is ill. There are two classification systems about classifying the major and the minor ones based on this grading system. It's called the Southampton classification and the asepsis classification. Let's go one by one. Southampton classification has 5 grades. Grade 0 is normal. 1 is normal, but except that there is a mild bruise or an erythema. Grade 2 has erythema along with signs of inflammation such as the Callar Dollar tumor, Functio Lisa, etc. And grade 3 has discharge, clear discharge, hemoserous discharge, and 4 major complication slash pus. Asepsis, it is a mnemonic by itself, it's an acronym. Asepsis stands for additional treatment is required, serous discharge, erythema, PS purulent, S is separation, I for isolation, and it says hospital stay is increased. Abscess, it has all the 5 cardinal features of inflammation. So puncture, antibioma, and puncture is often associated with an abscess. So injection site abscess is very well known fact. And whenever there's an abscess, we have to do incision and drainage. So this is a cellulitis. You can see there is erythema and swelling there. This picture indicates lymphadenitis, so we can see the lymphatic flow there. In these areas, there is an infection in the wound site and lymph drainage. That's lymphadenitis. This one is called gas gangrene, so it is caused mainly by Clostridium. So you can see these pieces. These are the main features of gas gangrene. The next one, yeah, this one is opisthotonus and opisthotonus, and this is trismus. So yeah, you guessed it right. Tetanus is also there. And so these are the other infection of surgical importance. Otherwise, well, so you want to skip 10 seconds, I don't mind, because I'm gonna show something really disturbing. At least it was disturbing to me. So skip at 20 seconds. So yeah, this is a necrotizing fasciitis caused by flesh-eating bacteria, and this is a consequence of it. There is shameful exposure of the testicles, so here. And so yeah, those are some examples. Systemic diseases like bacteremia, SARS, viral hepatitis, HIV is also there. Most dangerous among all is the hollow needle injury. It's because, see, in a hollow needle injury, there is sufficient amount of blood which can enter, so it will significantly increase the chance of getting the person infected for sure. So most dangerous is what the surgeon does. So while suturing or doing an incision, the index finger of the non-dominant hand is going to be the most commonly injured site, which is why personal protective instruments are needed. So scrubs along with head covers are needed. Head covers to prevent the infection from the hair to enter into the patient. So it's mainly to prevent the patient from getting infected. Otherwise, goggles are used, gumboots, face masks, gloves. Preferably 2 gloves are used, especially in people with HIV or hepatitis or any other high-risk diseases. These two surgical gloves are required. One gloves, either gloves is on over each other. So the largest gloves should be inside and the smaller one should be outside because that is pretty convenient. And so this is how a surgical and operation theater has to look like, because only limited number of people has to be there. It should be calm and clean, so only few people have to be there and minimal movement has to occur. Whenever you want to transfer something, you want to give something to the other surgeon, you want to use a kidney tray, just don't use a sharp, don't hand it on the hand. So PPE, preventive measures, so these goggles and mask and the surgical gown, gloves and gumboots. Essential people alone have to be there. Movement should be done very limitedly and the surgery should be done meticulously, slowly. Hand washing is the key. Of course, we can use alcohol wipes, but the spores had to be killed. The hand washing is the only technique by which the spores will be killed. So to kill the spores, we do hand washing, and the skin shaving for for the patient is done just prior to the surgery. If we plan to do it the day before, there will be significant amount of bacteria which is growing underneath the skin then. So scrubbing and skin preparation, it's done using chlorhexidine or povidone iodine. Adequate sterilization of the instrument is also essential. Antibiotic prophylaxis is not generally needed for a clean surgery except when the clean surgery is involving prosthesis. And expected pathogenic organisms have to be given prophylaxis against, because we know what organisms are running inside our hospitals. A single shot of IV induction for anesthesia is needed rather than any other technique of anesthesia. We can repeat the antibiotic prophylaxis if necessary, and if there's a heart disease or a prosthesis, we have to check for bacteremia. It will be safe to prevent it. Post-op wound infections is mainly reflecting poor hospital standards. Cellulitis typically occur after 3 to 4 days of the surgery, and pus will start some 7 to 10 days after surgery. Empirical antibiotics are very helpful. So whenever there's a tension, it means pus is present, which needs opening. After opening, we can do a delayed primary / secondary closure. Whenever we take the pus, it can be cultured in order to just check for antibiotic susceptibility testing, and a swab can be immersed in a transport media to ensure this. So there is tension here. We need to remove it. Okay, this is how a pus looks like, and this is a pus too, so we need to drain it. So about the treatment principles, the antibiotics are given. The antibiotics, however, should never replace the surgery, because we really have to remove whatever tissue is dead or infected. It has to be the antibiotics should be used to treat the spreading or to prevent systemic disease, identify the organism and the sensitivity of the organism as well. So what we need to do is we need to use antibiotics as narrow as possible rather than using broad spectrum antibiotics, because that will cause pseudomembranous colitis, etc. And empirical antibiotics, most commonly used ones are amoxicillin, gentamicin, metronidazole together. Metronidazole gives a very good cover for anaerobes, amoxicillin for aerobe bacteria, gentamicin too. And what are generally used are benzyl penicillin, flucloxacillin. The ticked ones are used for pseudomonial infections, so amoxiclav, that is amoxicillin and clavulanic acid combination, ampicillin, piperacillin, ticarcillin are very commonly used for pseudomonas. Cephalosporins and aminoglycosides are also used. Vancomycin, teicoplanin. Vancomycin is used for MRSA. Teicoplanin is used for VRSA, that is vancomycin resistant Staphylococcus aureus. Carbapenem and metronidazole are the mainstay treatment for anaerobes. Ciprofloxacin is also used for Pseudomonas. Okay, so comment your favorite topic, guys. You can rewatch this video in order to revise. See us and comment down your favorite topics. I will make a video of that. You'll really like it. Thanks.